Welcome everyone. In today's video, we are going to talk about the Volar modified Henry approach to the distal radius. This is also popularly called the FCR approach, as the Flexor Carpi Radialis tendon is the key to this approach. This approach provides excellent exposure of the volar aspect of distal radius. The plane in this approach is between the Flexor Carpi Radialis and the radial artery. So this is the plane in this approach. Common procedures using this approach are open reduction and internal fixation of distal radius fractures, bone grafting for non-union of distal radius fracture, osteotomy of distal radius, radial styloidectomy, and brachioradialis release. Now let us have a look at the technique of this approach. The position is supine position and a tourniquet is applied in the arm. An exsanguinating bandage may be used in this approach. The incision is a longitudinal incision just over the Flexor Carpi Radialis tendon. Distally it starts from the thin crease of the wrist, and proximally the length will depend on the nature of the pathology and the length of the plate to be used. Following this, the subcutaneous tissues are cut in line with the incision and the deep fascia over the Flexor Carpi Radialis tendon is incised. The Flexor Carpi Radialis tendon is retracted towards the ulna to expose the fascia over the Pronator Quadratus. So when we retract the FCR tendon towards the ulna, we will expose the fascia over the Pronator Quadratus. Now the Flexor Pollicis Longus tendon lies below the Flexor Carpi Radialis tendon and may also come in the way and is retracted towards the ulna to improve the exposure. Now the Pronator Quadratus is exposed and we have to detach this Pronator Quadratus from the anterolateral border and the anterior surface, which is done in an L-shaped manner. So we make an L and detach the Pronator Quadratus. This allows the repair and coverage of the implant following the surgery. The other methods of raising the pronator is just detachment of the distal part of the Pronator Quadratus and sliding the plate. This is used in a minimally invasive approach. The third approach is cutting the muscle in the line of the incision. However, this approach does not allow repair of the muscle and covering of the implant. So the most commonly used method is this L-shaped detachment. Now the muscle is reflected ulnarward and this exposes the radius. Following this, the procedure is performed and the Pronator Quadratus is repaired. Now let us see the dangers in this approach. The first structure is the radial artery, which lies in the lateral part of the wound, which may be accidentally incised. So we have to be careful and stay over the Flexor Carpi Radialis tendon, and that is why it is called the FCR approach. If we give the incision over the FCR and incise the fascia of the over the FCR and stay in line with the FCR, we are not going to damage the radial artery. To identify the radial artery, the venae committantes running along with the radial artery can be helpful. The next structure is the median nerve. The median nerve lies in the ulnar side of the approach. So what we have to do is avoid straying medial to the Flexor Carpi Radialis. So we have to stay in line with the Flexor Carpi Radialis till we raise the Pronator Quadratus. And once we raise the Pronator Quadratus, we have to use this elevated Pronator Quadratus as protection. So now we are going to elevate this Pronator Quadratus and we are going to apply our retractors over this elevated Pronator Quadratus to protect the medial structures, and this will protect the median nerve. So friends, in this approach we discussed the Flexor Carpi Radialis approach to the distal radius or the Volar modified Henry approach to the distal radius. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.